Hello, this is Inga Hansen, editor of MedEsthetics magazine. Thank you all so much for joining us. We're going to go ahead and get started. If you have any questions during the webinar, you can type them into the question box on the right-hand side of your screen, and we'll answer them at the end of the presentation. And today we're going to be talking about how to incorporate effective pre- and post-procedure skincare procedures to help boost revenue and improve patient satisfaction. Our presenter is Candace Noonan. Candace is a licensed esthetician and master trainer for Derma Concepts, which distributes the Environ skincare line. She holds certificates in advanced skin analysis, dermal needling, and oncology aesthetics, and speaks at medical and skincare conferences throughout the country. Welcome, Candace.
Thank you so much, Inga. We really do appreciate this time. Thank you, everybody, for joining. I hope you enjoyed the webinar today. So what we're going to be discussing today is an integral part of what should be going on in your practice. And it's not just about the dollar signs. It's not just about selling. It's about giving your clients the best outcomes possible. So by incorporating our effective pre- and post-procedure skincare can actually help boost ROI. So why is skincare so important? So basically, we're going to cover a lot more of this in detail as we go on. But the principles of this is that your pre-treatment prior to doing these procedures helps to create a healthier skin. And the healthier the skin that is prior to these procedures, the better the outcome will be. So you can really help the skin recover better. And by a better recovery, by a healthier skin, you can help improve your reputation as well. Post-treatment, the healthier the skin is, the better it's going to have into a better improved healing time. So you're going to have shorter healing periods with less downtime, and we're going to help to reduce the risk of scarring or pigmentation. By doing this as well, by sending them out with a corrective post-procedure skincare, we're also going to create client loyalty. They'll use the product post-procedure, they'll fall in love with the product, and if you're using an exclusive product, they're going to come back to you to replace it. And every time they come back to you to replace their skincare, you can introduce them to something else that's going on in your practice. Maybe you've just introduced cool sculpting, maybe you've just introduced a new facial injection procedure. By having them come back to replenish their skincare regimen, you have the opportunity and this captive audience to really showcase what you're doing at your practice. The fact is, if one home care product is sold to a client, there's a 30% chance that the client will return. If there's 2 products, there's a 60% chance, and 3 products, there's a 90% chance. So the more products you sell to them, the greater the chances of them returning to your practice. An important statistic that was given to us by the American Med Spa Association is that retail should contribute up to 18 or even 20% of the total income of an average med spa. If you are not tracking your sales, if you are not getting that percentage of income from retail sales, you're doing your med spa a disservice. It's an imperative part of the business plan of a med spa to ensure that retail makes up a big percentage of the spa's income. An interesting statistic that AmSpa shared as well is that they project that in about 5 years, the med spa industry will double in size. This means there is more competition, there is more people offering perhaps even the same products that you have, the same procedures, so you really have to set yourself apart. And how do you do that? Customer service, client loyalty, and a lot of this can be achieved through incorporating the corrective skincare and offering them a really good pre- and post-procedural regimen for them to follow. So you want to control the outcome, and this is why skincare is so important. If you let the client leave your practice after having done an ablative laser without any corrective home care products, they're simply going to go to a over-the-counter place and replace their skincare with whatever it is that they are sold at that point by the over-the-counter people. And let's face it, Some of those over-the-counter people are not skincare professionals. They have not studied skin anatomy. They don't know skin physiology, and they could be simply selling the client based on marketing. So by ensuring that you're sending the client home with the correct skincare product, it ensures the fact that you can control the outcome. At the end of the day, that outcome, that face that's walking around on the streets, and everybody's looking at that face, either thinking, wow, they're looking amazing. I wonder what they did. Let me ask her, and getting a good referral and a good testimonial. If they go home with the incorrect skincare or buy the incorrect skincare from somebody who doesn't know what they're doing, they are walking billboard for you, and they might be saying to those people, instead of, oh, you must go to this practice, I had the best experience with the best outcome, they might be saying, I'm not really sure about this procedure. I didn't quite see the result I expected. And that's not because of the procedure, it's because of that incorrect skincare. By maintaining control of the client's home care regimen, it ensures that the client is using the correct product to augment the procedure. There are many procedures that there is a contraindication to using certain medications either pre or post. If a client consultation has not been gone through, that the client has not been informed of this, or even that the client leaves your practice without that correct skincare, they could go and make such silly choices and terrible decisions and really have an impact on the outcome. And like I said, being that walking billboard for you, it's important that that client has exactly what they need to achieve the best outcome. By doing that, you're going to improve overall radiance and a more youthful character. And this client loyalty is really tied to an exclusive product offering. This also ties into how you choose which product line you are going to have represented in your practice. It needs to be in line with your practice's image, in line with the procedures that you are offering. And by having an exclusive product that isn't available widely spread, you have the opportunity again to make sure that the client only comes back to you to replace it. So how do we help make the skin look healthy? It's important to choose an effective skincare line. And there's a lot of different aspects that will go into choosing the skincare line. Firstly, you have to look at the ingredients. You have to make sure that the ingredient deck is conducive to preparing the skin prior to the treatment that you prescribed, and also the right ingredients to treat the skin post-operatively so that you can get the best results. Packaging is important. It's all very well to have a shiny tube on the shelf that looks pretty, but if you depress that tube, does it suck air back into the product, degrading the vitamins? It's all nice to have a wonderful tub of an ingredient, of a certain product like a facial moisturizer or an eye cream on your shelf. It looks very pretty, but every time you open up that wide mouth jar, do you expose the product to air, heat, light, and bacteria, degrading the product? So look for packaging where it protects the integrity of the ingredients so that they're protected from the environment and they don't oxidize before the clients even had a chance to use them. Manufacturing is important. Third-party manufacturers sometimes cannot produce at the same high quality that an independent manufacturing facility can. If there is a product line that you can find that has an independent manufacturing facility, you know that the facility will be able to be so sterile, so compliant, and so forthcoming with the standards of manufacturing that you could even produce without preservatives in it. A single plant manufacturer is able to really focus and target the exact specifics to produce a product that is high level, high quality, and protected throughout the manufacturing process. It's important to protect the ingredients, the raw materials, from exposure to the environment. So manufacturing can be done under low lighting and nitrogen blankets and put into these specialized packages so that the integrity of the product is maintained from inception to the minute you finish dispensing it. A step-up program is an important factor to look to as well. By having a skincare line that offers a step-up program, you're able to treat even the most sensitive skins, and then you step them up through the program, gradually increasing the dosages of these valuable ingredients until they're using what could be the equivalent of a prescription strength product. But because you've used the step-up program, the skin has been able to acclimate and form cellular receptors so that it can accept more and more of these topical ingredients into the skin cell itself where it's being used. So a step-up program helps to treat even the most sensitive skins. It helps to acclimate those skins, and it helps to move any skin through the program to high ultimate dosages of these effective ingredients without any irritation while you're going through this program. Your ingredients, your products should be in line with practices that the procedures that your practice offers. There's no point in offering a gel that does cellulite repair unless you're able to couple it with a procedure that maybe be body sculpting in office. And if you do have body sculpting, coupling a product that does complement that by helping to the client to augment the results at home is a great idea. Look for a product line that doesn't have any online catalog or over-the-counter sales. This should only be medically affiliated, because this means that you have a niche market product that is going to go back and tie into your client loyalty. If you sell a product that is available through the mass market or available through every med spa that you basically know of, what drives the client back to your practice? Having exclusivity and exclusive products that will drive the client back through your doors. Make sure when you're partnering with a product line that they do become your strategic partner. You don't simply want to be a vendor. You don't just want to be a number in a big conglomerate sales book page. You don't want to be just another old account that doesn't get any attention. Maybe you get a few bonus, gratis products thrown your way based on your targets, but you really want to make sure that you're partnering with a product line that's going to treat you like a partner, that they're going to have a vested interest in your practice and growing your practice with you. And that's going to offer you things outside of just selling you a skincare product and throwing you a few bones every now and then. You want to make sure that they're able to offer you things like open house support, marketing support, free collateral, free marketing, access to online websites where you can download marketing material and blog material and reposts and hashtags and all these things that are going to help build your business from the inside out. An important aspect of what a skincare line should be offering you is in-house education, either be it through webinars or recorded webinars, live webinars, in-house trainings, regional trainings. Education is key to making sure that a product line is successful in your practice. And this should come from your vendor. Your vendor should be able to offer you this kind of support. So this is just an example. This lady had a neck lift a year prior to having this photograph taken. And you can see that her skin still looks crepey. And she actually went to the physician who did the neck lift and said, "Oh my gosh, doctor, you did a terrible job." And the doctor actually responded, they said, "No, my dear, you unfortunately do not have great skin. So let's get you on a regimen and let's see what we can do." And this is after a year of using the product. So the before picture is actually after the facial, the neck lift, and the after picture is after the neck lift and incorporating skincare. And here is just a typical example of how skincare can help to augment the results you're getting from your in-office procedures. So you want to choose your products that are specifically matched to augment your practice treatment offering. So some of the procedures that are complemented by skincare: facial plastic surgery, laser resurfacing, body treatments, chemical peels, medical microneedling, cosmetic procedures such as neurotoxins and fillers. There are many of your treatments that can be directly enhanced by the use of the corrective home care. Now, many surgeons also make the mistake of believing that they can achieve youthful skin by using drastic measures, and that includes things like laser resurfacing, heavy peels, or other techniques that in fact end up destroying the epidermis. But the epidermis is far too important and complex to be destroyed or tortured into becoming smooth. The epidermis is an extremely thin layer. It's only about 0.2 millimeters thick, which is thinner than the average sheet of paper. This fine membrane, made up mainly of differentiating keratinocytes, is our only protection from the harsh world outside. It is extremely intricate and is not merely a series of layers of dead or dying skin cells. The destiny of those differentiated keratinocytes is to become the complex stratum corneum that is our real protection. And this outermost layer of the skin is even thinner and is only about 0.01 to 0.02 millimeters thick. So we should be very careful about the use of physical or chemical abrasives. The convoluted lipid bilayers that fill the space between the corneocytes create the protective properties of the stratum corneum. Healthy keratinocytes are ultimately responsible for a beautiful, resilient skin. So our first aim must be to rehabilitate the photoaged, ineffective keratinocytes to create a normal, healthy epidermis. And this will set up the possibility of improving the dermis and also related in augmenting the results from any of these procedures that you are offering. So our skin physiology. The skin is very complex. It's our largest organ of the body. And it's really important to understand how the skin being treated preoperatively can really augment the results. Now, the reason for this preoperative treatment of skin is to make sure that the skin is as elastic as possible before treatment, and also to make sure that the skin cells themselves are working optimally and will repair any wounds as rapidly as possible. We have to focus our attention on a few special cells: stem cell keratinocytes and differentiated keratinocytes, the melanocytes, the Langerhans cells, and the differentiated fibroblasts and their stem cells. Because their genetic code is most likely damaged to some degree, we have to nourish each of these cells back to optimum health and to help normalize the DNA as much as we can. Basically, we should be able to treat most of our patients by using combinations of the following: adequate UV light protection every day, replenishment of the essential skin vitamins that are unstable when exposed to sunlight, and particularly, but obviously not only, vitamins A, there's B12, vitamin C, and vitamin E. Replacement of carotenoids and other free radical scavengers and antioxidants. Active peptides such as matrixyl and damaxyl. These help to promote collagen and elastin. The use of alpha hydroxy acids periodically or really only when necessary. And some light chemical peels can also help to prepare the skin preoperatively. Cosmetic surgeons can use cosmetics as though they are pharmaceutics by examining the declaration of ingredients and then by selecting products that have suitable active ingredients. So some of the active ingredients that we mentioned is vitamin A. Vitamin A is known as one of the skin's natural DNA regulators. It's a natural stem cell stimulator as well, so we don't need to use stem cells, which in themselves can be controversial because of the where they're sourced from or how they're packaged, and are they actually stem cells when they arrive to you in your finished product. Vitamin A is known as a stem cell resource stimulator, so it's a DNA regulator. It really is what's going to change your skin. Vitamin C is very well known in the industry. It's really a great cosmetic ingredient where it's going to help improve all the damage, that visible damage that has manifested from the DNA damage. So vitamin A helps to address the DNA damage in the skin cell. Vitamin C helps to address all the damage, the appearance of the damage from that damaged skin cell. Vitamin E is an excellent antioxidant, important to help protect the cellular membrane of each and every skin cell. It's an oil-soluble vitamin, so it's very important to include as part of your skincare regimen. Interestingly enough, it's not a very strong antioxidant. It's quite weak, and when it's been used up as an antioxidant, it may become a free radical. So you'll notice a lot of companies incorporate vitamin C with vitamin E, so that the vitamin C can stabilize vitamin E once it's been used up as a free radical scavenger, and then it can go on to protect the cellular membranes. Lots of different antioxidants are important. Our skin is multiple layers of oil and water and membranes and intracellular and extracellular fluids. So we need antioxidants that work in all those different phases of the skin. So we need antioxidants such as green tea, vitamin C and E, as we've mentioned, lycopene, resveratrol, coenzyme Q10, lutein, rosemary leaf extract, just to name a few of the antioxidants. Growth factors are important to supply to the skin as well. Now, growth factors themselves is basically the way that your skin communicates. And basically, when your skin communicates, that's when your skin is actually releasing a growth factor. Now, when we're young, our skin produces a lot of growth factors. This is how the keratinocytes talk to each other, talk to the melanocytes, and control the functionality of the skin. But as we age, as with most skin physiology, things start depleting and things go downhill. And the same with our skin. The skin doesn't communicate as well and doesn't release all these natural growth factors. So topical supplementation of growth factors helps to improve the skin functionality. Peptides are newer to the market, newer to the skincare market, and basically these are short-chain amino acids. And these short-chain amino acids are like keys in a door. They unlock certain functionalities in the skin. We've mentioned matrixyl. This builds collagen. Domaxyl improves the dermal matrix. There's even neuropeptides that block the nerve responses that tell muscles to crease, and those include things like arginine, lufazil, Vialox, Cinake. These are different peptides, and each of them do certain things in the skin. There's peptides for skin lightening. There's peptides for antioxidants. There's peptides for skin functionality. So peptides included in a skincare regimen is a great way to really target specific skin functions. But it doesn't count if you have all these amazing ingredients working on the skin from the inside out, regulating DNA, brightening, lightening, improving hydration, improving fine lines and wrinkles, regulating stem cell deposition. All of this goes to waste if you do not have your product in airless pumps. Exposure to the environment degrades ingredients. So make sure that you do not have a product that you stick your fingers in every day, exposing it to air, light, and the environment. Having airless pumps is really important. That dedicated manufacturing facility will help to ensure, and you can rest assured that from the minute of manufacture to the moment it's put into that airless pump, that the integrity of the manufacturing facility has maintained the strength and the viability of those ingredients. Creating a sterile environment allows for manufacture even without preservatives, because there's no risk for contamination, because the facility is operating at such an optimum. That step-up program is important because you cannot start on a high dose of these ingredients. Your skin has to build up the receptor sites in order to accept all these vitamins. It's much like having a parking lot outside your building. You may only start with 2 parking spots for your building, but as you consistently fill those 2 parking spots, your landlord may give you a 3rd parking spot. And for as long as you consistently filling up that 3rd parking spot, he may give you 4, 5, 6. But as soon as you get to a level that you're not using all those parking spots, he may take them away. And this is what happens with our skin. So a step-up program, building receptor sites, allowing more and more and more gradual doses of these vitamins into the skin, helps to avoid the risk of reactions. Typically, vitamin A is one of the biggest culprits of reactions. They're called retinoid reactions. And this is where you don't have enough parking spots on your cellular membrane to allow these cars into your building. So these molecules or cars hang around outside the cellular matrix, and they wreak havoc on the surrounding skin cells. It loosens the desmosomes, it fractures them, and now you've got a whole bunch of skin cells that are dry on the surface, and you've got a skin that's a little red and sensitive and might break out. So to avoid that, we use should look for skin-friendly forms of the vitamins and put them in a step-up program. And by putting it in a step-up program, again, it goes back to and ties into that client loyalty. The client will understand that they're starting on low levels now, but there is a program to get them to ultimate levels of these vitamins and ingredients. And by doing that, they know that they have to come back to you. So that again ties into no online sales and not a mass marketed product. that is a driving force to get these clients back into your practice. The Step Up program helps to decrease the risk of reactions and allows us to even treat the most hardy of sun-damaging photo-aged skins or even the most sensitive skins with varying levels of key ingredients. We know education is the key. It is important to have educated staff, that they themselves are using the product, they are walking testimonial boards. If you have a staff complement that is excited about the skincare line you are carrying, they are going to be recommending it to everybody they come into contact with. They know the benefit of it. It's a service, and actually it's a disservice if you're not talking to those customers that come through your door about skincare. Those providers can assist your busy physicians who do not have time to spend on product recommendations. Their time is far better spent doing surgery, firing lasers, doing Botox injection, versus spending half an hour with Mrs. Jones trying to explain to her why this product is so important for her to use. Your providers become that walking billboard and testimonial. If they walk into the room while Mrs. Jones is waiting and her skin is just glowing, Mrs. Jones is going to be more inclined to ask her about product recommendations. Education of patients is a necessity. It's not a luxury. There is so many misinformation on the internet. What Mrs. Jones' sister and auntie and uncle, who are skincare experts, have been telling her about what should or should not be used on the skin. So by having a professional person who in your practice who is established as an authority, you will have a good impact on this client, helping them to dissuade the real from the unreal. Clarifying your staff as experts is also important, making sure that any certification that they have, any advanced courses that they've gone to, any certificates that they've received go up on the practice walls. So as the clients are walking through, they see that they're in the hands of professionals who are well educated. So then it becomes more of an education versus a selling of the products. Educated patients will understand the benefits of using the correct home care. They'll understand that by going home with a certain product, their outcome, the investment that they've made in a procedure will be augmented by the investment they're making in the skin. So make sure that you can choose a vendor that will partner with you through marketing and sell through product, but most importantly, with education for your staff. By educating the staff, giving them gratis products based on performance, they can use the product and speak to it with truthful testimony. Putting this all together, it's sometimes difficult as an esthetician or a nurse practitioner to sit in a practice with an expectation of doing sales and think to themselves, I'm not a salesperson. So the first thing that we need to do is make sure that your staff understand that this isn't a sale, it's an education. And you're doing your client a disservice if you're not educating them on what they need to use on a daily basis. So making sure that they tell the client about how to simply cleanse, tone, protect, and moisturize their skin, what ingredients they should be looking for. And it can come from an unbiased point as well, talking from an experience, or talking from before and after books, or talking from other people's testimonies about using a product, using an ingredient, and the experience they've had. Now, through all this, consultation is an important aspect. Most practices, most successful practices, will offer consultation free to a client. This can be something of an hour's worth of time with the client. Giving it free obviously helps the client to commit to it, but it gives you the opportunity to sit an hour dedicated, uninterrupted time with the client and educate them. Educate them on their skin, what their skin needs. So offering a free consultation is a key important part. By doing this, you're able to analyze the skin. At this time, you can take before and after photographs and add this to your library and your client's record card. This will be important to help establish baselines. And think of it like this: you losing weight, you look at yourself every day, every day, every day, and the change might be so small that you don't see it. But if you had taken a picture today, and then in a month's time, you've lost 5 pounds, and you take a picture then, that differential becomes impactful. The same with skin. When your skin slowly but surely gets healthier and healthier, you're looking at your skin every day in the mirror. So to notice those subtle changes might not happen. It might be difficult. Like using a lash enhancement serum. You're thinking to yourself, this stuff isn't working. But had you taken a before picture, compared it with that after picture, you'll notice the big change. So during that consultation, if you don't have a system like a Vizia to really document those photographs, make sure that you have a space and a practice, a step of procedures, a line of procedures that you take in order to take these photographs, so that you can have a professional set of photographs to really use before and after. These are so great to add to a library that you can then use in your marketing, in your social media. These are unique to you. They're not stock photos. What better marketing will you have on hand if you have a great set of before and after photos with the consent from the consumer to be able to share these, either online, on social media, or simply by creating posters for your own in-office marketing. So during that consultation, the before and after is important. Educating the client about their skin and what the esthetician is seeing during that consultation process. Listening to the client about what their concerns are, most importantly, will help you to establish viable goals. You need to set up goals, and within that, you need to set up a timeline, because it's much the same as signing up at the gym. If you go to a personal trainer, he's not going to sit you down. You're not going to sign up for personal training. In your first session, he walks in and he says, okay, drop down and give me 20. He's going to sit your first training session and say to you, okay, what do you want to achieve, and how long do you think it's going to take you to achieve that? And you may say, oh, I want to drop 20 pounds and I want to do it in 2 weeks. And during that process, he'll say to you, it's a great goal, but I don't think it's realistic. I think you can drop 20 pounds, become more lean, drop percentage body fat, but I think it's going to take close upwards on 6 weeks or 8 weeks or whatever that number is. It gives you a realistic timeline to set before you start judging the outcome. The worst thing you want to do is overpromise and underdeliver. So it's important to set up what the goal is and establish a timeline that you'll take that after photograph and start comparing. At that time, it's also important to discuss client responsibility. It's all very well you go to the gym and you sign up for a 6-week program of doing 12 personal training sessions, but every time you leave the gym, you're going to eat Dunkin' Donuts and you're having 6 burgers and 3 milkshakes. The personal trainer will sit with you and say, right, I'm going to give you this goal within 6 weeks. We're going to drop 20% body fat. However, this is your responsibility. Here is the diet you need to follow. Do you agree? Yes, I agree. As skincare therapists and consultants, we should be doing the exact same thing. We should be setting a goal, but not taking all the responsibility just on ourselves, just on the procedures that we are performing to achieve that goal. The client has responsibility. Things like avoiding sun, staying out of the sun, about using things like making sure they're using the products, using them correctly, using them morning and evening, using them diligently, using them how they're supposed to be used. So making sure that during that client consultation, setting up the program for success. This is the opportunity to also start pre-treatment. A skin will respond better and be healthier to the procedures. Let me rephrase. A skin that is healthier will respond better to procedures. And that is just a simple fact. I've seen many before and afters of simple lasers being done or lasers with skincare, the result. I've seen clinical studies done with medical microneedling on its own, and then the result of medical microneedling with skincare incorporated. And the difference between the two is astounding. So skincare does make a difference. So at the client consultation, education, before and after pictures, setting up a plan for procedures that they're going to do in office with the concurrent and conducive home care. And at that point, this is a great time to set up that pre-treatment to ensure that the skin is healthy prior to doing any of your selective or your proposed procedures during that time period. Now we talk about post-operative skincare. So we've spoken about how during the consultation, you'll set up a series of treatments that you're going to do, talk about the associated skincare and why we need to use it at least 3 weeks prior to a series of treatments being performed, because the skin needs to be healthier, it becomes more resistant, and there's less risk of untoward effects and less downtime. Now they've come in for the treatment. Now we start talking about post-operative skincare. When should the patient continue product use after either IPL, radiofrequency, non-ablative lasers, skin needling, facelifts, etc.? So all patients should continue their normal cosmetic regimen as soon after the procedure as they feel comfortable to do so. So with peeling, IPL, radiofrequency, light, non-ablative laser, and skin needling, this is done immediately after the treatment. For ablative laser treatments, the cosmeceutics can be used even on the raw areas, though the dosage of the topical vitamin A, if that's being incorporated, should be rather drastically reduced for the initial 10 days. A very soothing vitamin A-based gel not only helps to cool the skin, but also supplies the vitamin A at a suitable level. Patients who've had a facelift, etc., can apply cosmeceutic creams as soon as their bandages are removed. Cosmeceutics may be applied even onto the facelift scars themselves. There is no danger of infection, and the scars heal rapidly and evenly, becoming much less visible than untreated scars. Another method that has been used to treat the scars is with a low-dose peeling agent, a 2.5% TCA cream peel for about 10 minutes at each visit after the operation. The TCA helps to sterilize the wound and treats subclinical infection, and hence reduces the risk of inflammation. We have physicians that have used this, and generally scars heal faster, and uninformed clinical observers have often been surprised to see that wounds at 2 weeks post-operatively seem to be similar to conventional scars at the 6 to 12-week mark. We've used peeling directly on the scars within 2 days after a facelift for the past 10 years, and we believe that the scars now have the best ability to heal. Many patients believe that they should be careful using topical vitamin A soon after surgery because of the popular misconception that vitamin A makes the skin thinner. Retinoic acid is not the best form of vitamin A soon after surgery or surface treatments because it's rather harsh. Clinicians who are used to the dry, pink, uncomfortable skin may see the reaction as a good sign, but to the patient it's extremely inconvenient and in fact unpleasant. It becomes a good reason to stop using it or to use it irregularly. When one uses the storage form of vitamin A, one gets compliant patients with all the benefits of vitamin A, but without the discomfort, sun sensitivity, and often disturbing appearance. Even post-operatively, you should persuade your patients to increase the levels of vitamin A, etc., C, E, antioxidants, until they're using up to 50,000 IUs of vitamin A twice a day, if possible. But this might take months and an episodic minor retinoid reactions to get up to that level. So that's why we use the step-up program. This will ensure the healthiest, most radiant skin to complement your surgery and procedures. So we've spoken about the importance of skincare, both pre-operatively and post-operatively, what to look for in an efficacious skincare line in terms of the ingredients, the packaging, the manufacturing standard, and also from a business point of view that there are strategic partners not available online and not mass marketed, and how important it is to educate your staff to drive sales. So some practices have very successfully appointed a point person to do education, and every month at the sales staff meeting, that point person will present just on their area of expertise. So one point person in your office may be the skincare expert, And you may have multiple skincare lines, so you may have multiple experts. And once a month, they'll rotate through and they'll talk about a refresher course on what sets the skincare line apart and how to use it and what to do. So the educator staff will help to drive sales. But ultimately, what does this mean to your bottom line? It's basically trading dollars for hours. A procedure in office may last an average of 60 minutes. And that is your finite number of dollars that you can earn per hour. When you're offering products in conjunction with procedures, you are boosting the revenue per hour by adding those products. So your procedure plus your home care has an infinite amount of income value versus just your procedure in that limited and finite number of hours. So your procedures can only yield income while actually being performed. How many laser treatments can you fit in 1 hour? But that's your finite number. That's your finite dollar amount per time spent doing that treatment. But if you have skincare associated to that, you have an incremental amount of dollars that you can add, still only working within that 1 hour. Your product helps to increase profitability, even at the expense, and this is not at the expense of time. So the amount of time that you're seeing the client is still the same, but your revenue off each client increases every time they leave the office with the treatment product. This can be a revenue stream even while the practice's lights are off. Now, there are many companies that do not want you to sell online because this protects the entire industry of online sales. But there is a way that you can have your practice's website have a professional portal that your clients can sign up to access this password protected portal. And there you can put your practice's specific products online for sale. This doesn't then affect the industry's no online sales policy, but allows you to give your clients access to your website, and then they can purchase product directly off the website. At that point, they would have gone through their consultation. They know which products they need to use, to buy, and how to use it. And this is a way for you to increase revenue while your practice's lights are off. And again, your product encourages that return visit because the client has to come back to you to get this eye gel that she's absolutely fallen in love with, but she cannot get it anywhere else. And guess what, Mrs. Jones, you came in for your eye gel, but this month we have a special on our neurotoxins. Buy 9, get the 10th one free, or whatever it is. At that point, introducing the client to something else that's going on in the practice. It's a captive audience. So incorporating the skincare, summarizing now, bringing it all together, you have to rely on your staff. Your staff are your educators. They have to be very well educated themselves. It doesn't help them talking about an eye gel and just blabbering through it if they don't know about it. So having them educated on the benefits of the ingredients and how to use it. If they're using it themselves, even better, because they become that walking billboard and personal testimony. It's the best testimony that you'll ever get. Have the vendor that you're working with offer incentives for sales. Some vendors will work with you and offer incentives such as if the practice sells $2,000 in wholesale product a month, each esthetician that has sold individually up to 1,000 will get 1 free product. And 2,000 will get 2 free products, or 3,000 they'll get 3 free products. So work with a vendor that will work with you. Also, offering compensation is pretty much standard practice nowadays in the industry. You have to give your staff an incentive to want to educate and sell product. There's been great programs, that's things like pass the buck. So whoever sells the most in one day gets a $100 bill or a gift certificate or a gift basket, and whoever sells every day the most gets the gift basket, so it sort of gets handed around. but then by the end of the week, whoever's holding the basket gets to take it. So there are many ways to incentivize your staff internally. I know one practice, if they achieved a certain level of sales, that the entire staff, they were sent a special maid service to clean their houses. And then the individual performers were given gratis products and extra incentives and bonuses. This is a great way to get your vendor involved. Ask them about creating a incentive program for your staff that incorporates not only individual incentives, but a practice incentive as well. Work on packages that incorporate skincare as part of the cost. If you're offering body sculpting, there's really no reason not to offer a body sculpting product that they're using at home. We know it will augment the results and it increases your ROI. Sell product to a client in preparation for the procedure at the time of booking. That way you get buy-in. That way they know their responsibility, that they also have to do something at home in order to get the best results. And this kind of thing can also be used post-procedure to ensure the optimum outcome. So in summary, and this is a quote from Dr. Des Fernandez, a world-renowned plastic surgeon, cosmeceutic skincare is essential to complement a facial cosmetic surgery and achieve rejuvenation. A brief explanation of the action of the major cosmeceuticals precedes their method of use. Vitamin A, especially in its ester forms, gives all the benefits without the irritation of retinoic acid and should be used on every patient, both before and after surgery. Its role is both preventative against photoaging as well as regenerative. Antioxidants work hand in hand with vitamin A and also complement sun protection, but act only in preventing photoaging to a degree. Iontophoresis and sonophoresis may enhance the penetration of vitamin A and active peptides and can also help surgeons achieve realistic rejuvenation. Series light peels may also be useful, giving a fresher appearance to the skin. So in conclusion, when procedures are done, you want the skin to be healthy as possible, heal rapidly, and heal with minimal risk of post-traumatic hyperpigmentation or scarring or stress to the skin. This will create an opportunity to create client loyalty, having the client come back to repurchase products that are exclusively available through your practice. This, along with increased client retention and satisfaction, will boost your bottom line and improve your revenue. I hope that you have found this beneficial and have heard at least one tip or trick that may help in the long-term inclusion of skincare into your practice that will ultimately boost your ROI. Thank you so much for joining today.
Thank you so much, Candace. That was really wonderful. And we have a few minutes for questions. So if you have any questions, please do type them into the box on the right-hand side. And if we don't get to anything before the end of the webinar, Candace can follow up with you, and you certainly are welcome to reach out to her at dermaconcepts.com. And I had a couple questions. There are people who wanted to look at some of the slides again, a couple people who came in late and wanted to share this. So this webinar will be available at MedEstheticsMagazine.com/webinar and on the MedEsthetics YouTube channel for people who want to go back and review or share it with their staff. And one question that came in was, when it comes to doing light chemical peels pre-treatment, how far in advance should those be performed?
That's a great question. So what we recommend is that pre-treatment in a hurry is really 3 weeks. We really recommend, and this is through the experience of plastic surgeons that have been dealing with this for many years and have many papers put out on the subject. They think that 3 weeks prior to a procedure is the minimum amount of time that you need to be on corrective skincare to ensure for a healthy skin. In that period, you can offer a series of light peels. And when we say light peels, we're talking about a maximum of a 5% TCA or a lactic acid. So no solution peels, just very simple light peels with the combination of a low percentage with a low pH that will really just help to sterilize the skin, remove the excess stratum corneum, and really help to stimulate the skin's own natural growth factors, including transforming growth factor beta 3, which helps to lay down more collagen. So just making the whole skin healthier. But within that 3-week period, you'd probably at most be able to get in 2, maximum of 3 weekly peel treatments, but again, being very, very light, very, very non-invasive on the skin, and really just stimulating the skin. So this isn't your proverbial traditional deep chemical peel. It's just a very light treatment in order to get the skin healthy. And this we can perform if you're doing it with a 2.5 or a 5% TCA, you can do weekly, and this would be a minimum of 3 weeks prior to your procedure.
Great. And somebody had asked, they wanted to look at that quote from Dr. Fernandez, and I don't know if you're able to put that up for a moment.
I can.
Okay. And then I had another question about the sun protection daily. Do you recommend a physical only, or do you recommend a combination of physical and chemical protection?
So there is quite a lot of controversy about chemical sunscreens. Basically, chemical sunscreens can penetrate into your skin. They don't sit on top of your skin. And energy doesn't dissipate. Energy doesn't go away. So when these sunscreen chemicals absorb the energy from the sun as UV radiation, they don't know what to do with it. It doesn't go anywhere. It's not like when your melanin absorbs it, it's able to dissipate the energy. The sunscreen chemicals can't do anything with this energy, so they start to spin really, really, really quickly, and they dissipate that energy into your skin as heat. Some skins can tolerate that, but other skins, that heat can really cause a lot of inflammation, and that's where the controversy and the little bit of, I'm not really sure if that's so great for my skin comes in. I know that there's a lot of people that I personally have experienced have said, I'm allergic to sunscreen. And it's not that they're allergic to sunscreen, it's that sunscreen causes heat in their skin, thereby causing inflammation, and thereby can damage your skin. So personally, my recommendation would always be to stick with the physical blockers, either titanium dioxide or zinc oxide. Zinc oxide is an excellent sunscreen blocker, a physical blocker. However, it can be a little difficult to put into a finished product. I like to equate it to, I have an 11-year-old son who is amazing. He's lovely. He's a super smart kid, and he's such a love. But how does he interact with other kids on the playground? Is he a bully? Is he a pushover? What is he, the funny kid? What kind of kid is he? Zinc oxide's the bully. He doesn't really play well with other ingredients. So that's why zinc you'll often find with a very simple formulation deck. Titanium plays a little better with others, even though it's not as good of a sunscreen. It plays better with others. So you'll find titanium is able to be put in to a more broad spectrum cosmetic chemistry deck. So lots of other ingredients can go in with titanium. But either one of those are a very good recommendation. But as always, you need to find a sunscreen that has a good balance between a high protection from titanium and zinc, but also that cosmetically pleasing appearance, so that you don't look like back in South Africa when I grew up, the cricketers used to have these zinc, just basically white strips across their noses from the zinc oxide, and it was very, very occlusive. So, we have to find that balance between what's cosmetically pleasing and what's actually going to do the work. And that's the difficulty as a cosmetic chemist when working with zinc oxide and titanium oxide. Look for a sunscreen that is free of chemicals, has one of those 2 physical blockers, and added antioxidants is a bonus, because they will sort of help mop up any damage that your skin may have if you didn't put your sunscreen on thick enough, or if it rubbed off, or you sweated, or you got wet. The antioxidants will then sort of take place of that secondary protection where the titanium or the zinc might falter.
Great. And real quick, we're going to try and get one more question in, but somebody had asked about how to get more training, and I was wondering if you would be willing to share your email. And certainly my email here is ihansen@creativeage.com, IHANSEN. And if you could share yours, I think they'd like to reach out to you directly.
Absolutely. It's my first name, Candace, CANDACE, @dermaconcepts.com. So you see it on the screen now, dermaconcepts, DERMACONCEPTS.com. So it's Candace, CANDACE, @dermaconcepts.com.
Great. And somebody had a question about the scar. You talked about using a 2% PCA on a faceless scar, and was wondering how often do the patients use that, and can they use like a home care product, a specific line, or is this done in office?
So when we were talking about the 2.5% TCA, we were talking about doing that in office. So post-operatively on a facelift scar, when the client comes in for their post-operative checkups, the 2.5% cream can be applied to the facelift sutures at that point and removed just after 10 minutes. And really, as we mentioned, it's just about sterilizing the skin. It's not about peeling it at that point because of the low percentage. It's just about sterilizing the skin. And that can be done every time the client comes in for a post-operative checkup. Alternatively, you can send them home with a peel. That would be more for facial rejuvenation. There is a product available, a 2.5% home cream peel. It's a TCA. We have protocols that you can actually use that daily on acneic skin for as long as the skin remains comfortable, or weekly for an anti-aging client regimen. And again, because it's a 2.5% cream, it's really more about rejuvenating the skin than peeling it. We actually, at that point, we're peeling with a purpose. So instead of just sloughing the skin and, removing those outermost layers, we're actually using the physiology of the skin, where the skin's going to release its own growth factors and stimulate its own collagen deposition through the pure action of the pH change of the skin. So by applying the peel to the skin, we change the pH, and that threatens the keratinocytes with the thought of death. They think to themselves, oh my gosh, we're under attack by this change of this acidic pH, and they release growth factors, and that's where the rejuvenation comes in.
Terrific. And we do have more questions that are continuing to come in, but unfortunately we are out of time for our 1-hour webinar. So to the people who have sent questions in, Candace will follow up with you and we will get answers to you. But thank you all so much for joining us today. And Candace, thank you so much for presenting this webinar.
Always such a pleasure. Thank you.